Hi, I'm Kathy Snap, the Orthopedic Program Administrator for Norman Regional Health System. We are glad that you have chosen Norman Regional Health System for your total knee or total hip replacement. We perform over 800 total knee and total hip replacement surgeries a year. Our mission is to provide state-of-the-art, innovative orthopedic care in a patient-centered manner to help our patients function at their optimal level. Our vision is to set the standard for orthopedic care in our region and advance health and wellness in our community through education, clinical care, community involvement, and social responsibility. What matters most to us is helping our patients live their best lives. Patients who participate in preoperative education prior to total joint replacement report less stress and anxiety during their recovery process compared to those patients who do not participate in preoperative education. Please make sure to leave your name when prompted during this video to ensure that your surgeon and navigator are aware that you have watched the video. This video is for patients who are undergoing either a total knee or total hip replacement surgery and have been approved by their surgeon for same-day surgery, which means to discharge home on the day of surgery. In order to assist you with successfully preparing for surgery, we have created the 6 vital factors for a successful surgery. You will be given this sheet during your pre-admission visit. The 6 vital factors to a successful surgery is also page 3 in your preoperative notebook. Please read this sheet carefully and follow all of the instructions. The 6 vital factors for a successful surgery are: number 1, coach. Choose a family member or friend to serve as your coach throughout this process. You will be more successful if you have someone there to encourage, support, and assist you. You will also need someone to assist you at home once you are discharged. They don't have to be there 24/7, but do need to be available frequently during the day for when you need assistance, especially for the first several days you are at home. Number 2, home. Prepare your home for when you are discharged. Remove all throw rugs, place frequently used items at countertop height, install night lights in the bathrooms and bedroom, prepare and freeze meals, and arrange for any help around the house, such as with cleaning, getting mail, or lawn care. Number 3, equipment. Locate all equipment you may already own that can be useful after surgery, such as a walker, shower chair, or toilet riser. For a walker, we prefer the 2-wheeled walkers as they offer the most safety while still remaining mobile. If you don't have any equipment, don't worry. Our staff will assist you with obtaining the necessary equipment, either during your pre-admission visit or during your stay. Number 4, notebook. You will be given a preoperative notebook at your surgeon's office when you decide upon surgery. If you do not receive a notebook from your surgeon, you should receive one during your pre-admission visit with the nurse. Please take the time to read through the notebook. It has lots of useful information and helpful tips to guide you in a successful hospital stay and recovery. If you did not receive a notebook, please call me at 405-307-1715 and we will arrange to send a notebook to you. Number 5, exercises. Please begin the exercises shown in your preoperative notebook. This will give you a head start on your recovery. Number 6, ice packs. Ice is useful to decrease your pain during recovery and can help you not require as much pain medication. Make and freeze your homemade ice packs according to the instructions in your preoperative notebook. Follow and check off the 6 vital factors for a successful recovery. Weeks leading up to surgery. If you use tobacco products, you need to stop for at least 4 weeks prior to and after your surgery. Patients who are unable to stop tobacco products have a higher rate of infection compared to those that are able to stop before and after surgery. If you use tobacco products, please talk to your surgeon about nicotine replacement therapy. The Oklahoma Tobacco Helpline is also a good resource. Special criteria for same-day discharge. You must have someone available to assist you upon discharge, as well as the first few days at home. You must have filled your post-operative prescriptions. You must have a rolling walker and bring the rolling walker with you on the day of surgery. You must have scheduled your first follow-up physical therapy visit for the day after your surgery. Day before surgery. Since you are discharging the same day as surgery, make sure your coach is available the entire day so that they can participate in your recovery, therapy sessions, and education. They also need to be able to drive you home. The surgery department will call you the business day prior to surgery to let you know what your arrival time is for the next day. Ensure that you stay well hydrated. Drink plenty of water and Gatorade. You must stop all solid food and full liquids 8 hours prior to your arrival time. You may continue to have clear liquids, including black coffee or tea, up until 2 hours before your arrival time. Wash your bed sheets and covers. Sleep on clean bed sheets and covers. If you have animals, don't allow them to sleep on your bed the night before surgery. Remember to use a Hibiclens or antimicrobial soap when you take a shower the night before surgery. You should have received Hibiclens or antimicrobial soap during your pre-admission visit with the nurse. Use this soap for at least 2 full minutes before rinsing. If you did not receive any soap samples, please call me at 405-307-1715. For more information on preparing for surgery, if you are having a total knee replacement, refer to Section A, Prepare for Surgery, and Section E, Understanding Your Total Knee Replacement, in your preoperative notebook. Section A is a dark purple section, and Section E is a yellow section. If you are having a total hip replacement, refer to Section A, Prepare for Surgery, and Section F, Understanding Your Total Hip Replacement, in your preoperative notebook. Section A is a dark purple section, and Section F is a light blue section. Day of surgery. Repeat the Hibiclens shower the morning of surgery. Again, use a soap and lather for at least 2 full minutes before rinsing. Arrive at the Healthplex at your designated arrival time. You will check in on the 2nd floor of the Healthplex at the surgery check-in desk. You will be given directions on where to check in during your pre-admission visit or phone call. Once you are checked in and taken back, your surgery will not occur immediately. Time is needed for a vital sign check as well as a final check-in with your surgeon and anesthesiologist. Please view our anesthesia video for more information. A total knee replacement or total hip replacement surgery itself generally takes at least 45 minutes to slightly over an hour. Once your surgery is complete, the surgeon will update your family and you will be taken to the recovery unit. In the recovery unit, the staff will closely monitor your vital signs and how you are recovering after surgery. Most patients spend approximately an hour in the recovery unit, and then they will be taken to our ambulatory care unit or same-day surgery unit, upon which your coach will be brought to you. Ambulatory care unit or same-day surgery. Once you're in the same-day unit, physical therapy will coordinate with your nurse to determine when you are ready to get up and work with therapy. Physical therapy will instruct you in your total knee or total hip exercise program in order to ensure that you can improve your strength and flexibility in your operative leg at home. This exercise program is illustrated in both a preoperative notebook as well as a discharge notebook. We also have separate exercise videos, total knee exercise program, or total hip exercise program for those who are more visual learners. The exercise program videos are located on the same webpage as this preoperative video. Physical therapy will also work with you and assess your ability to get in and out of bed, get in and out of a chair with a rolling walker, and walk with a rolling walker. When getting up and moving, if you have had a posterior total hip replacement, you will likely have specific movement restrictions or total hip precautions that you need to follow in order to decrease the risk of your hip dislocating. You need to follow these hip precautions until your surgeon tells you otherwise. Your 3 total hip precautions are: number 1, do not bend forward past 90 degrees. Number 2, keep your knees apart. Do not cross your legs at the knees or ankles. Number 3, do not turn your operative leg in. When working on mobility and walking skills, we will have you use a 2-wheeled walker. We use a 2-wheeled walker after surgery because it offers the highest level of safety and stability. We do not recommend the use of a 3-wheeled or a 4-wheeled walker after surgery because it simply doesn't offer the same level of balance, stability, and safety that a 2-wheeled walker does. We also do not recommend the use of a walker without wheels, also known as a standard walker. A standard walker tends to put more stress and strain on your low back when compared to a rolling walker. A standard walker also must be picked up in order to advance it forward, which creates an increased risk of a fall due to your hip instability following surgery. If you have your own walker or you have borrowed a walker prior to surgery, we ask that you bring it in with you when you come in for surgery. This is to make sure your physical therapist can check for the proper fit and safety of your walker. This demonstration is the same if you have had a total hip or a total knee replacement. If you have had a total hip replacement, you will move this way in order to maintain your hip precautions. If you have had a total knee replacement, you will move this way to avoid putting undue stress or strain on your knee. When getting out of bed, we will have you bend your knee on your non-operative leg and push down with your foot in order to scoot your hips over to the side of the bed. Once your hips are on the side of the bed, you will slowly lower both legs over the side of the bed. While you are bringing your legs out to the side, you will push yourself up and scoot yourself all the way out to the edge of the bed. Once you are sitting on the side of the bed, before you stand up, you need to make sure that your non-operative foot is positioned behind you. In order to maintain your hip precautions, we will have you position your operative foot in front of you. When using a walker, a lot of people think that they should place both hands on the walker and pull themselves up using the walker itself. If you pull up on the walker tends to tip backwards, making it unstable and unsafe. So we want you to put both hands on the bed, chair, or mat, lean forward, then push up with your arms and your legs. This does require a decent amount of upper body strength. If you are unable to push up into standing with both hands on the mat, we will instead have you put one hand on the bed and one hand on the walker. Once you are standing, we want you to stand up as tall as you can, and we do want you to put weight through your operative leg. Sometimes after surgery, people are afraid to put weight through that operative leg. They are afraid that they will hurt or damage that new knee joint or hip joint. Actually, the exact opposite is true. When you put weight down through your operative leg, the pressure from that weight stimulates your bone to heal and grow into that new hip or knee joint. You will be weight bearing as tolerated after surgery, which means you should put as much weight as you can tolerate through your operative leg when you are standing or walking. When walking with the walker, your first step is to move the walker forward. Move it forward about an arm's length in front of you. Then you will take a decent sized step forward with your operative leg, followed by a smaller step forward with your non-operative leg. This will allow you to keep your operative leg in front of you, which is what we want, especially the first few days after surgery, as it puts less strain on your operative leg and is safer. So when you are walking, you will take a larger step with your operative leg and a shorter step with your non-operative leg. The time we want you to be very careful walking is when you go to sit back down. When stepping back to sit down on something, you need to make sure you step back first with your non-operative leg. If you were to step back first with your operative leg, it would put increased stress and strain on your operative hip, making your leg more likely to buckle. So again, you want to keep your operative leg foot in front of you, step back with your non-operative foot, followed by a small step with your operative leg, and then pull the walker back. Repeat, non-operative leg, small step with the operative leg, pull the walker back until you can feel the bed mat or chair behind your non-operative leg. Once you can feel the surface behind you, then take a small step forward with your operative leg to ensure that you keep your operative leg in front of you and you are not breaking your hip precautions when you go to sit back down. Reach back first with one hand and then the other, slowly lowering yourself down. Discharge criteria. There are several things that staff and your surgeon will look at to determine when you are ready to discharge home that day. The discharge criteria are divided into three main areas: medical, patient-related, and mobility-related. Medical items. 1. Be able to tolerate a light meal and fluids. 2. Be able to void or urinate independently. 3. No uncontrolled vomiting. You may have some light nausea. 4. Heart rate, blood pressure, and breathing are all within normal limits. Patient items. 1. Your pain must be controlled with pain pills. 2. Your coach is present in the room during the PT evaluation, and they demonstrate the ability to assist you with transfers and your care at home. 3. Any questions from you or your coach have been thoroughly asked and answered prior to your discharge. Mobility items. 1. You are able to walk about 80 feet using a rolling walker with assistance from your coach if needed. 2. You are able to stand up from the bed using your rolling walker, again with assistance from your coach if needed. 3. You are able to walk into the bathroom and use the bathroom using your rolling walker with assistance from your coach if needed. Discharge instructions. While you are in the hospital, your nurses and therapists will provide you with instructions specific to your individual care, and these will be included in your discharge instructions that your nurse will print off and review with you before you go home. This video is designed to provide general information regarding your home care to assist in making your recovery home as smooth and safe as possible. Every patient who undergoes a total knee or total hip replacement should be given 3 additional items upon discharge: the 6 vital factors for a successful recovery, a discharge notebook for total knee and total hip replacement surgery, and a Where Do I Go discharge flyer. If you do not receive these items, please call me at 405-307-1715 and I will send these items to you. Similar to the 6 vital factors for a successful surgery that we use to prepare you for surgery, we have the 6 vital factors for a successful recovery after surgery to aid you in your recovery at home. The 6 vital factors for a successful recovery after surgery are: number 1, elevation for swelling. It is normal to have increased swelling in your legs once you are at home. Elevate your leg above the level of your heart for at least 30 minutes 2 times a day. Number 2, ice for pain. It is normal to have some increase in pain after you are at home. Ice your knee or hip for 20 minutes while you are elevating your leg at least 2 times a day. Remember to protect your skin by placing a layer of cloth, such as a towel or a pillowcase, between the ice and your skin. Number 3, blood clot prevention. Your surgeon has prescribed a blood thinner for you. This medication must be taken as prescribed at the approximate same time every day. Sometimes our surgeons will prescribe aspirin as a blood thinner. If your surgeon has prescribed aspirin for a blood thinner, it is very important that you take it every day in order to prevent blood clots. 4, constipation. Constipation is normal after surgery. Take Miralax or another laxative daily until you have a bowel movement. If you have not had a bowel movement in 2 days, increase the Miralax to twice a day until you do have a bowel movement. 5, activity is tolerated. It is important to move and stay active once you are at home. Be up and moving is tolerated. If you feel that you have overexerted yourself, your first step needs to be to rest, ice, and elevate your leg. Number 6, nutrition. Calorie and protein needs are higher after your surgical procedure. Proper nutrition is important for optimal healing and recovery. Aim to eat 3 well-balanced meals a day, along with 2 snacks as tolerated. If you have any questions or concerns once you are at home, please call our ortho hotline at 405-515-6700. There are a couple of tips to keep in mind as you go home and you perform your daily self-care tasks. Always use your rolling walker when walking around your home. You can also hang your towel and clothes over the front bar of your walker in order to carry them from room to room. Keep items such as soap and shampoos close to you when showering so you aren't tempted to lean over too far. Perform all of your dressing and bathing tasks from a seated position, and remember to dress your operative leg first. Keep items that you frequently use in the kitchen and bathroom on the countertops so that you will not have to bend over too far or reach up too high in cabinets. Slide heavy items along the countertops so that you can keep both hands safely on your walker. Remember to sit down to open food containers and to prepare meals. If you have had a posterior total hip replacement, remember to use all of the equipment in your hip kit so that you can perform your self-care tasks while maintaining your total hip precautions. We also have several tips related to your mobility skills. First, it's important to not keep your legs in a dependent position too much once you are at home, especially for the first week or so. A dependent position is one in which your feet are below the level of your knees, such as when you are sitting in a chair. Don't sit in a dependent position for more than 30 minutes at a time. Also, make sure you change positions frequently. Don't sit still too long. It is better to get up more often for short periods of time than to get up less but for longer periods of time. It is very important to move and to stay active once you are at home. You need to be up and moving as tolerated. If you feel you have overexerted yourself, your first step needs to be to rest, ice, and elevate your leg. Second, you need to continue to perform your exercise program twice a day, every day at home. Most people will perform their exercises before or after breakfast or dinner. We don't really care when you perform the exercises, as long as you perform them twice a day and there is a break in between. After having knee or hip surgery, it tends to place increased stress on your low back, so we do recommend that you perform your exercise program on a bed, rather than in a recliner or on the couch, as the bed will provide increased postural support. Initially, you will perform the same exercise program at home that you were shown here in the hospital. Your outpatient PT will advance your exercise program as you progress. Next, we have several general fall prevention tips. Please remove all throw rugs and keep your hallways clear. Have good lighting and always use night lights, especially in the bedrooms and bathrooms. Avoid long nightgowns, pants, or robes that drag on the ground, as these can cause you to trip. Make sure that you wear shoes that fit securely, have a back to them, and also have a non-skid sole. Also, be very careful around pets, especially when you first come home, as they tend to be very excited to see you and may cause you to trip. If you have pets, when you come home for the first time, we recommend that you come in and sit down and then have the pets brought in to see you. Also, be cautious when sitting down. Make sure your legs touch the chair and that you reach for the armrest while you sit down slowly. If you have several steps or stairs at home, you need to have a sturdy handrail and someone with you the first few times that you go up and down steps. Have an emergency plan in place in case you fall. If you are going to be alone for longer periods of time, please make sure someone is going to call or check on you at regular intervals, and always carry a cell phone with you. Also, take your time. Don't rush. Move at safe speeds. All of this information is included in your discharge notebook. Your discharge notebook also includes a recovery log. This recovery log will help you keep track of your activities, goals, and progress during the first month of your recovery. Please take the time to fill this out every day and bring it with you to your physical therapy visits so that you can review your log with your therapist. Once you are discharged home, our orthopedic nurse navigator will call you within 72 hours. Even if you are doing great, please take the time to answer the phone so that we will know that you are doing okay. The nurse navigator is a bridge between your surgeon, the hospital, and you. They will be your primary follow-up contact once you are discharged home. The nurse navigator will assist you with any follow-up questions or concerns that you may have. The Where Do I Go discharge flyer is also designed to assist you if you have questions or concerns about discharge. It reviews the most common questions or concerns that patients have once they are at home and assists you in determining the best option for receiving assistance. The 4 areas on the Where to Go discharge flyer are orthopedic office, primary care physician, same-day walk-in/urgent care clinic, and the emergency department. Orthopedic office. If you are in doubt, call this number first. They will help you with routine care and discharge follow-up concerns, such as questions about your pain medications or blood thinners. If you have increased pain or increased drainage from your incision, if you are unable to start your follow-up physical therapy, you need to call your orthopedic physician's office. They will assist you with any of these concerns. Primary care physician. Call your primary care physician for routine and preventative care. This is when you are having problems with a chronic condition such as COPD, CHF, asthma, or diabetes following your joint replacement surgery. Also call your primary care physician if you are having complaints of a routine illness, such as a cold or flu. Same-day urgent care walk-in clinic. Go to this clinic when you need medical care, but you can wait for a few hours. This would be when you are concerned regarding uncontrolled pain or swelling, uncontrolled nausea or vomiting, diarrhea, or constipation. They can also help you if you have called your doctor's office but were unable to get in the same day and still need assistance, and also if your doctor's office advised you to go to an urgent care or same-day clinic. Emergency room. This is for fast, life-saving care. This is for when your life is in danger. Concerns would be shortness of breath or trouble breathing, chest pain, fainting or passing out, bleeding that doesn't stop, seizures, a serious accident, and stroke symptoms such as facial drooping, arm weakness, or slurred speech. The Where to Go discharge flyer also includes the orthopedic hotline phone number, which is 405-515-6700, as well as the orthopedic program administrator number, which is 405-307-1715. Thank you for taking the time to watch this video. We are glad that you have chosen Norman Regional Health System for your healthcare needs, and we're looking forward to working with you soon. If you have any questions or concerns after watching this video, please call me, Kathy Snap, Orthopedic Program Administrator, at 405-307-1715.